In this video, we're going to share some ideas. Our centers are busy places where a lot needs to get done to provide the best care for patients. And we often hear that centers have two major challenges in staffing their centers. First, we know some clinics have a challenging time maintaining the ideal ratio of PCTs to patients, often due to challenges in recruiting, hiring, and retaining PCTs. When the clinic has fewer than the optimal ratio of PCTs to patients, the PCTs get burned out from working more hours than expected, and RNs sometimes have to pick up the slack and work below their license. Second, after investing 3 months in training a new PCT, many PCTs leave the village in the first few weeks of being in direct patient care because they don't find the job fulfilling, the hours don't work well for them, or they decide to leave for other reasons. We've gathered input from teams and believe there's an alternative way to approach these challenges. Introducing the DaVita PCA, Patient Care Associate. This isn't a new role, it's a new pathway to becoming a happy and fulfilled PCT. We believe this will help with PCT staffing challenges, resulting in smooth clinic operations, and ultimately provide great care for our patients. Here's how it works. The PCA will receive 3 to 4 weeks of initial training on day-to-day, lower-risk clinical skills. To move beyond the initial training phase, a PCA will complete a skills checklist and pass a final exam on these tasks. After the 3 to 4 weeks of initial training, the PCA will begin 4 to 6 weeks of direct patient care, working on the treatment floor in partnership with an existing PCT to serve 6 patients, rather than a single PCT covering the typical 4 patients. Let's review. Here's what the PCA can do and what they cannot do yet. After the 4 to 6 weeks of direct patient care, the PCA begins another phase over the next 10 to 12 weeks, spending 2 days a week completing their PCT training and 2 days a week working on the floor using the skills they've been signed off on. During this period, as they learn, perfect, and are signed off on a new skill, they can perform the new skill as they partner with the PCT to care for the 6 patients. This provides relief to the center by getting new teammates on the floor quicker, frees up extra nurse capacity from covering PCT tasks, and gives us and new teammates time to assess job fit sooner rather than later. Think of the PCA as a different pathway to becoming a PCT. This is not a long-term change to your PCT training approach, but instead it's a bridge when you don't have enough PCTs, getting you to a well-resourced team as quickly as possible. If this idea feels like it solves a problem you are currently managing, reach out to your regional operating director or division vice president.